That's better.
Hi, everyone. Welcome to MSL, and thanks for joining us today. Today we're talking about things that MS nurses really know a lot about, and that's accessing healthcare. And today and that's been certainly something that we've seen has been a huge challenge in COVID for lots of people, and we're hearing more and more that that's been an issue. So what we thought we'd do today is talk to one of the MS nurses who's been at clinic, who's been an MS nurse. Actually, Louise has been an MS nurse for 20 years, over 20 years, but certainly through COVID has been with lots of people in a large MS clinic, helping them negotiate that. So thanks for joining us today, Louise.
Oh, it's a pleasure.
Tell us a little bit about what it's been like in the MS clinic in relation to accessing care for doctors and nurses.
I think that it's been a really interesting time, that not just for patients but for nurses and doctors, because the information has changed dramatically from last March 2020. I think it seems so long ago. So what we knew back then, and then what we thought, we never thought this year would continue. So I think it's been trying to go with the new information, trying to, things aren't stagnant, that you had to be, the new buzzwords are to be agile and to be able to pivot and change. And I think that's been really hard to learn to be flexible, that things aren't so set in their ways anymore. Your clinic appointments might change at the last minute. So for patients and clinicians on either side, it's been learning to adapt to new information and to be able to, try not to get too stressed with those changes.
It must have been quite stressful for the nurses and the doctors, just as much as it has been for patients.
Yeah, I think sometimes, it's great that we've got these long-term relationships with patients or clients that come to clinic, but it's also been great to share that, there's been stress on both sides, that certainly, our service wanted to do the best and have the most up-to-date information, but that also came with lots of stress for our colleagues who was being redeployed, what information to believe. And like clients, clinicians certainly got overloaded with information, unsure where to get your information. So it was just trying to step back a little bit and decide where you were going to get your information and what you were going to do to try and make yourself safe and also to make the patients as safe as possible. So, I think we meet very... there's been stress on both sides, and I think acknowledging that has been one of the lovely things when patients ask clinicians how they are.
That mutual acknowledgement that it's been really stressful on both sides must have been and I guess it's hard as time goes on. It's hard not to be grumpy. It's hard not to be a little bit grumpy sometimes as things get harder and as things go on. Have you found that too, that over time that sort of the harder it gets to access things?
I think everyone's reserves, whether you're a clinician or a patient, your reserves are getting reduced. And so often we take turns on the phone here, because certainly for a nurse or the admin who's taking the phone calls, they're exhausted as well. So, when you feel like you're getting, not responding in the kindest way, it's just better to get up and let someone else take the phone call. And maybe if you're a client ringing the service, if you've had a really grumpy day, maybe if you save it till tomorrow, because it is that flux of grumpiness, and you won't get the best information and the calmest conversation if one of you is really grumpy. And I think just acknowledging that from both sides has been really helpful.
That's for sure. So telehealth's been a huge thing. And certainly, in clinic, it must have really changed. What have you been it's a new way of accessing healthcare that is new to so many people. My observation has been that there's lots of people who have experienced it quite differently. Some people have loved it, and some people have just thought it was just not the way to go. What's been your experience of it?
I think at our service here, we've been lucky that all our rooms have telehealth. So there wasn't the issue of availability. And telehealth at the beginning seemed such a great idea that, you could talk to people. But what we found, and at the beginning it was reassuring, but we found that clients were not on their best behaviour, but we noticed and started laughing that, everyone was very neatly dressed at home and the kitchen was perfect. And they didn't want to worry us, so that they actually weren't telling how they were really feeling. As time's gone on, that's changed a lot, so that now people are much more comfortable on telehealth to say, look, things aren't great. I have these symptoms I want to talk about. So the experience of telehealth is getting a lot more real now, with clients being able to actually declare that they're not feeling great. So that's changed over time, how people are talking on telehealth. The other really interesting thing that I think has happened is often the unequal relationship when you come into a hospital and a clinician room, that it's a different environment. But when you're at home and your dog's on your lap and you're calm and your partner or friends are there, you get such a much more interesting conversation of who that person is, what their values are, what their preferences are. So that has changed our view of this is not just the person with MS, this is the person who loves their animals, who loves their family, and the decisions they make with shared decision making are really important to that whole unit, not just to that one person.
So the neurologist, that's really interesting. I think that you having that window into someone's life through the screen, sounds like it's making a real difference to the way that people are seeing people with MS, which sounds like it's a bonus.
Yeah.
And have the neurologists noticed that too?
They definitely have. So there's been lots of talk of, I never knew that they, it sounds corny, but I never knew that they had such a beautiful garden and that was their passion. I never knew that they had such beautiful animals and never met the partner before, so all those things have really added to a much richer relationship. And not to say that some patients really miss the one-on-one communication that you will get when you can touch someone and actually, it doesn't replace that, but it's opened up another window that we never knew. So you've got to take, I think for us, taking some positive out of that, MS affects families and affects social interactions and who this person is and their preferences.
So perhaps a tip for people would be to not have a perfect kitchen, or you don't need to have a perfect kitchen behind you to be able to do that. It's good to hear that it doesn't have to be all tidy and that you can give you opportunity to not feel that tension. Certainly something that.
And I think with the telehealth appointments, we've tried not to make them too short. So because we know that people will want to share their garden and their animals and family. And then when they're comfortable talking, then you can get down to, so what are the issues that are concerning you at the moment with your MS? So you need time to let people breathe and to actually share what they want to share at home and then get down to it. So you can't do a quick telehealth. It's, it's important to have that time.
And what about things like coming to clinic now, even when you go to a GP, there seems to be added so many more layers to things that you have to consider and think about in terms of, that ringing to check that if you have or haven't got symptoms. And do you think that having all these additional layers has sort of stopped people or made it hard for people to access their routine tests, not just clinic visits or tests or infusions? And Has that been a challenge that you've seen in clinic?
So I think when people know that know the process, so that they know that they need to have an extra 15 minutes to come into clinic or to come for their blood test or MRIs, that you do need to come through screening and you do need to answer some questions. And please don't come to the hospital if you have symptoms. So yeah, but so even just getting through that screening, if people are aware of that, they're less stressed and they've given that extra time to come through. I think that's really important. We've found at the service I work with, if patients know they can't bring someone with them into the hospital, if they know that ahead of time, they're much more calmer, they're less stressed if they know those things before. So I think if you really prepare and know, how do I access the hospital? How much extra time is that going to allow? Can I bring do I really need to bring someone in? And once they know that information, it's so much less stressful for people.
So that would be one of your tips, I guess, in terms of accessing healthcare more broadly, to sort of find out as much information about what you're going to need to do so that when you get there, it's not going to be as stressful how much time you need to do.
So that your partner might just go and sit in the park across from wherever you are, and that you can ring them when you're done. So they're still bringing you in, but you're actually, calmly coming to clinic, not being distressed at the check-in point when you find you can't bring your partner into the hospital, understanding why. And I think that's a great tip, that just reduces everyone's stress.
Yeah.
You don't need your partner sitting in the MRI waiting room if they can sit in the car outside.
Yeah, that sounds like a great tip. What about when something goes wrong and people are worried about their new symptoms? Have you how's the experience been of that, and how would you what advice would you give to people when they're sort of experiencing something new and that sense of worry about what's happening? What tips would you give people for that?
So I think the same thing, that we've been lucky in Victoria, and I can't speak for all of Australia, but at our service we've still got a phone line and an email. So we would encourage people to ring, and we would encourage people to ring with clear symptoms so that we can discuss them. And then we actually then can set up a quick telehealth. And then we've got the option, if it is a relapse, that oral steroids that we know, similar efficacy to IV, and that we've been able to, deliver oral steroids to people in their homes. So we're really trying to say to people that if you have new symptoms, you should, still call, still email, and if the call doesn't get back to you that day, then email, so that we've got a record of it, and that we will, and please ring again, because then we can really help.
I think certainly one of the things that we're hearing about is that it's okay to ring again, and it's okay to email again, because to gently prompt people is okay, because it can be quite busy, and lots of things, as you mentioned very briefly before. But I do know that in some of the hospitals, doctors and some of the nurses have been furloughed into other areas to work. So is that a thing as well too, that you're a bit down in manpower in clinic?
Not at the service I work at. We've been incredibly lucky so far not to be redeployed, or not to be. We've had some of the staff furloughed, but we've managed. But it's more the volume of phone calls. People are at home. They are focusing more. It's hard not, if you're at home and not working, to not focus on your symptoms and then be concerned. So I think it is just taking that moment to think, all right, has this symptom, is this been here for, longer than 24 hours? Is it something new? Okay, I'm going to ring so I can get some feedback, and just keep ringing and emailing back. For services that don't have an email response, or if their whole staff have been furloughed, then I really think your GP is the next person to be able to talk to, and to say, look, my health service appears to have been all redeployed. Can you assist with this? This is what I would normally have in the way of steroids. And then if the GP can't help, then of course ringing MSL or the MS Society in your area would be your next point of call. I think those things are really important, that it's not all at your service, that you have other avenues who can help.
Yeah, and what about one of the avenues, I guess, that people frequently go to get information, but also that sort of is someone else asking this question out there? What about that sort of Facebook, internet? Have you found people have used that more to sort of verify their experiences? And if so, what tips would you give people to sort of say, how would you, what to look for?
So I think the Facebook groups, and there's certainly lots of Facebook groups for different treatments, and some are American, some of them are Australian based. And so I think if I was looking, and I look at them quite often, if I was looking at them, I would want to know the rules of engagement on any Facebook group and any chat, so that it's clear that it's set up that there's no anti-vaccination information that would be seen as not in our health orders. I would be looking at, if someone says something about a drug, that it's linked back to a peer-reviewed journal. And some of the Facebook groups, I think, have fantastic information, and they are, they have access to the same journals a lot of the doctors do. So if something jumps out at you that it sounds really kind of weird and I didn't know that, then I'd say, so can you show me where you got that information from? I'd like to read that article myself. And then have it when you come and talk to your nurse or GP, to say, look, does this look like a reasonable, kind of peer-reviewed journal? I think those things are important. So not to dismiss everything out of Facebook, but just to question, where did they get that information from? Is it just one person? Is it a lot of people saying the same thing? And then asking, hey, has anyone seen an article on this? Is this something that's been presented at a conference? And a lot of people have access to the same stuff we do.
I think it is a new avenue to access some healthcare services, and to be able to speak with your peers, particularly if you're having a point of anxiety that you really want to talk through, or say, has anyone else does anyone else know this information? So I think there are some really good, credible sites, and it's just about sort of asking. I often think about asking when you look at a piece of information, asking with your head rather than your heart, and so sort of getting back to that information and say, does this sound reasonable? And so there are resources available to support people as well too with MS. And what about in terms of when that's happening? Is there any tips that you would give to people to prepare if they're wanting to ring someone or access something, or they've got a new symptom? How would they prepare for that? Like, have you got any advice on that?
Yeah, I definitely think that people coming to clinic or just having a phone call is to sit down with a cup of tea and calmly write down what it is that you want out of this phone call, and how are you going to explain your symptoms. So if you just ring me and start saying everything is terrible, I just can't walk, I'm going to have to go back over. So it is really helpful to just pause for a moment and go, well, has this been happening for the last 2 months, or did you wake up with this? When you say your legs are terrible, can you try to put and this is just in dot point, that it is really something that occurred last week. This is why I think it's worse. Last week I could walk 100 meters. Today I can't get to the bathroom. And to see, have I changed medication? Is there anything that's different? Have I just had a vaccine? Have I just had my infusion? And really think, all right, so now I want to know, this is my number one problem, and should I be worried about it? Can I wait to see someone? Can I get an earlier MRI? So really trying to focus on one or two issues that are the most that you want at that moment. And I think that's not just for new symptoms, but for any clinic visit. We prepare when we go into our tax. We prepare when we take the dog to the vet. So it should be the same for your clinic visit. So to really take that moment the day before to think, well, what is the things that remind me that I've got MS? If there's nothing that reminds you and you feel really well, what would I like to learn out of this visit to get the most education out of? And just making that most of that time. A lot of people now are taping their visits when they come to clinic because they say they'd really like to share it with their partner outside. So we have had different people on, telehealth at the same time or taping their appointments so that they can go back over that. And people are really open to that now.
Oh, that's great. I hadn't heard of that, but that's a really good tip as well, because how often do you forget things that have been said to you when you're feeling anxious about
Yeah.
that information? I think that idea as well of giving clarity to what's happening, what's impacted it, what's been the timing, that's really helpful when your usual resources are changed and not available to you too. So if you can't see your usual doctor, or you have to explain things to a GP, having that information already there is going to be something that will really it will empower people, I think, to be able to say, this is what's going on and this is what's important to me, rather than sort of feeling, as we've talked about, accessing healthcare is different now. We've got to go through all these steps to do that. And so that makes it even more important, I think, to really have that information ready for you. That's for sure.
And I think at some of the health services, when people have a query relapse or a new symptom, often we want to get them seen, in the next couple of days. So often it won't be with their, lead neurologist. So to get people in during COVID, we need people to be open to see other members of the team, and therefore to be able to really clarify, I'm here because I think I'm having a relapse, and to have really planned out, this is why I think I am or not, and to really help that neurologist who mightn't have seen you, who will have access to your notes, but to be really clear about what you're trying to discuss. And I think knowing other members in your team is incredibly important as well for these moments when your neurologist might be furloughed or sent to the ward. To be open to other members of the team to get you the best care in a timely fashion is really important. There's no point waiting to see your neurologist if they mightn't be available because they've been furloughed or sent to a COVID ward for the next 3 months. You need to fight for your MS, and I think, being able to see other people is really important, and being open to that.
Well, you've given us lots of tips there, Louise, and what we're going to do is put them all together and make them available to people. Some of the things I'll just go over. I mean, we know that accessing healthcare has been a challenge, and we know that everyone also has a really individual story and an individual challenge. For people who don't have the good fortune of having an amazing MS nurse, to be able to support them, or in an MS clinic, like you said, that in some places have had to all the staff have had to be redeployed into COVID wards. We know that everyone's having a unique and individual struggle. So MS Connect certainly loves to help people. The nurses on the end of the line love to help people navigate their way to the resources that they need. And certainly the tips that you've given us today will help our nurses be able to do that as well too, as well as helping the patients themselves. So some of the things, just in summary, write it down, and it'll help you have clarity as well too. Another thing is, potentially, if you're not able to write it down, you can talk it through with a trusted friend get that information as well too. We've talked about the importance of emailing and keeping on emailing, and prompting is okay, to prompt people that's okay, or even ask. Sometimes you just assume that people know that you've got an email and that you didn't know that the service actually had an email to be able to use. So it's good to ask how to do that access in the first place. To think about how you can get another way that you might be able to get the information that you need, and what are some reliable and good resources to get the information that you need as well. And there's lots of people available. The MS Connect and the MS nurses will help you sort out those if you're having some trouble with that. And also, I guess something we didn't touch on, but the importance, I think, of clarifying expectations. Clarifying when are you going to get back to me, and what's the time frame, so that people, it's okay to ask that question, and then you'll have a realistic idea of when people are going to get back to you and what the time frames are going to be. And also, I guess, the importance of being generous with our assumptions about what's going on in people's lives, and to understand that everyone in healthcare at the moment is under stress, but everyone wants to help, and so I think that's really important to know that everyone who's involved really does want to help people access, and to get the services that they need. It's just there's a mountain of challenges, so that's important to really remember that. So, anything else you've got to add to that, Louise?
No, I think, the last point that I'd make is, MS Connect has done some wonderful YouTubes and information, and I've found that often our consumer review sheets haven't been as successful during COVID. Some of the interviews that you've done, especially the one with Annika van der Walt and vaccines, I would encourage anyone listening to this Facebook group that hasn't seen your discussion with Annika on vaccines to please have a look. And hopefully, I would encourage everyone to get vaccinated and have that question. But the information there has been so well received that I think I would just encourage everyone to look at that if you're not vaccinated yet.
Part of that, accessing information that you need to be able to answer your questions when they're available, and certainly Annika does answer a lot of those frequently asked questions.
Yeah.
So in that video. Well, thank you for your time today. Good luck in the next few months coming ahead, and we hope that the light is at the end of the tunnel for all Melbourners. Thank you for you and your team, all that you've done to help people access healthcare. I know there's been so much work in the background to be able to keep people going to their treatments and their infusions and their MRIs. And so a big thank you to the team, and thanks for coming on today.
Thank you. Everyone have a good day.
Thanks.